I'm actually really optimistic about changes to come in drug pricing policy. I think what we've seen over the last couple of years is much greater awareness among policymakers about what's wrong. They see an unsustainability to the economics of the drug market, and they've started actually leaning into some solutions that 10 years ago I thought we would never get there.
When I think about drug pricing policy, and what is promising is that more and more people are getting access to information that has previously not been available to them. And I think it's helping them reassess their views of some long-held beliefs. And that is the only way we're actually going to get to some of the root causes of why drug prices are high.
Policymakers have a lot to think about when they're thinking about fair drug prices. One, they should be thinking about who those fair drug prices are for and how do they define fair. Are those prices for patients, payers, taxpayers? Are they for federal health programs like Medicare and Medicaid? And then how are we defining fair? What inputs are we putting into it? What data are we considering? What information? At the end of the day, a fair price is really getting down to, is the drug available to the person who needs it when they need it, and can they afford it?
Today's conversation about drug pricing policy is incredibly important because drugs are among the most widespread and useful interventions that we have in medicine. Thinking about drug pricing policy is a very important part of of thinking about healthcare policy overall.
Politics does matter here. Policies do not get done without the involvement of Congress. So listen in to the conversation around the political climate, how it's changing.
This is a complicated issue, and that there is no one silver bullet that is going to solve every problem, that we need policymaking at a lot of different levels to try to ensure fair drug prices.
It's okay getting small wins along the way, but if we really want to address this problem in a sustainable way, in a way that will actually make it easier for future generations to access their medicines, then we need to look at the long game and make those changes at the root cause.
So there's a lot more to do. There's more underlying problems that have to be addressed, and I think the door is opening to actually take those on. A better future is possible, and the path is laid out in front of us. And it really requires us just to roll up our sleeves and start the hard work of helping policymakers and the public understand what kinds of changes are both necessary and feasible.